Today I'm really excited because you're going to be able to see how bone marrow is done on me. I'm going to actually be the patient to have this procedure done so you can see how painless and simple this can be with this kit right here. So what's happening right now is we have Jen, our ace PA here, and she's going to find the spot where it was called my posterior superior iliac spine, and she's getting that. That's just right next to the midline of my spine, and that's the thickest part of my pelvis that has a very high concentration of mesenchymal stem cells. So she's finding that spot right now. She's going to mark that off. So first they're going to numb up that area with two different anesthetics. One's a short-acting, the other one's a longer-acting. The needles, we have to wash them with a special solution so that it doesn't clot. And everything's done under a sterile procedure there. Well, we're waiting for this anesthetic to take effect. Talking about the anesthetic, I've only had 2 Tylenol PMs. That's about all I've taken for this procedure. And just the local anesthetic. And usually that does the trick. The key of the anesthetic here is patience. So we inject, we wait about 5 minutes, and it takes about 5 minutes for the lidocaine to set up, and there's another longer acting anesthetic called ropivacaine. We use both those because they are less toxic to the cell. They have us in this prone position here because it's a lot easier to find the pelvis from the back. This is not your spine. This is next to your spine, and this area has some of the highest concentrations of stem cells that you have in your body, and the easiest area to find, and that's why we chose this spot. We aim 20 degrees lateral and towards the troch, inferior, 20-20, and we actually have a device coming out that we're calling 20-20 that guides the physician into that perfect spot. And now the key is to pull it out quick and as fast as possible, because that dislodges the stem cells from their vascular supply. Rapid pull technique, and you'll see this little bit of foam that we call the Hernigo champagne. Part of the proper technique is to get as maximum pressure as you can in each pull. That does produce a little bit of pain, maybe around a 2 or a 3 that I'm feeling right here, but there was a study done that they asked patients about their pain level during the procedure. And when they had a little bit more discomfort, they actually had a higher yield on the mesenchymal stem cells. So having a little bit more pain during that process where they're doing maximum pressure, that's a good sign. What we got here is, this is some of the bone marrow here, and we're going to mix this with the concentrate of the plasma proteins that we pulled off from the bone marrow. Now, traditionally, this was just thrown out in the garbage. In most systems, still throw it out in the garbage. But there are a lot of great things in here, a lot of great proteins like alpha-2 macroglobulin, and also even some of the IRAP is in this, and that would be just thrown out. There's also some nice fibrin in there, it's fibrinogen, that helps these two together to clot, because when we get a clot, then we get a nice slow release of the stem cells and those plasma proteins and those growth factors. So the slower the release, the more time it has to go ahead and do its stuff where it's supposed to be in that part of your joint or in your tendon. So she's going to mix this together, back and forth. We just slowly mix that back and forth together so that it totally incorporates into both. And this is really exciting that you get to see how this really works. And this is something totally different that a lot of places don't do, but Cellular Healing does. So before she injects again, we're going to do a little blessing on that bone marrow. Gives it that little extra touch. Okay. That's another thing that you get at Cellular Healing they don't get a lot of other places. Okay. Okay. So she's going into the subacromial space. That's it. That was how simple that was. It took about 10 minutes. The pain level was at maximum of 4. I only took Tylenol. And my shoulder, oh, you can actually feel the little creakiness in there right now. But, and it's still making that noise right now. But, well, I can also go ahead and show you how well this is going to work in about 3 months, because that's how long this is going to take to go ahead and change this around. And we can have another report at that point about how my shoulder is feeling. But I was so excited to go ahead and give you a chance to see how this is done, how simple this is, how this is a very tolerable procedure, and these are your cells for your healing. If you want to learn more about using your own cells to heal yourself, go ahead and call us at 810-299-8552. That's 810-299-8552. Talk to Kim or visit us on our website at cellularhealing.net. Remember, these are your cells for your healing.